My name is Ranita Manocha, and I'm a full member in the Hotchkiss Brain Institute. I'm also part of the Department of Clinical Neurosciences and an adjunct professor in kinesiology. And our research lab is called the Better Mobility Lab. We're really focused on how we can help people with impaired mobility move better and understanding their experiences. So we focus on people with connective tissue disorders, people that use walking aids, and people that use braces. I was a competitive figure skater as well as soccer player and runner. I competed nationally for figure skating. And when I was 15, I had my first knee surgery, had a number of surgeries since then, but that sort of kind of sparked my interest in how walking aids might cause problems for people. A lot of people, unless you've started using these things yourselves, don't realize, how painful it can be on your wrists or your shoulders and how it can cause skin problems for you. So I just thought, there has to be a better way. What can we do to design these devices better? And that sort of got me interested in biomechanics. And, working as a doctor, I always think about what's the clinical application as well. How can we help our patients? And during the pandemic, actually, a high school student that was working with me had mentioned maybe we could use technology that she had learned to teach people how to play the violin, to teach people how to use walking aids. So we got a small grant from the University of Calgary, a VPR Catalyst grant, and we developed 6 modules that taught people how to fit 6 different types of walking aids. And the way that the app works is really neat. Basically, people watch an educational video, and it breaks down the different components of the skill to them. And then they will have someone take a video of them performing that skill. And then they can actually watch their video compared to the demo video and look for each of those components. Am I doing this part properly or not? So for example, if I'm using my underarm or auxiliary crutches, am I leaning too far forward, leaning too far backward? Am I looking down? Is my chin up? And people really love seeing their own videos because they might think they're doing something properly, but then they realize, oh, actually, I could work on this a bit more, and people get a score at the end, which is also helpful for them to see their progress over time. So from those 6 modules back in 2021, we now have 55 modules, which is pretty neat. Teaching fitting, walking, and different walking patterns, because after, for example, surgery, as people recover, the way they need to use their walking aid might change. We also teach people how to get up and get into a chair, how to go up and down stairs. Even if people learn some of these skills, sometimes they forget what they were taught. So it's helpful for them to go back and review that too. The app's free and it's available in English, French, and Spanish. And we're always open to new languages if anyone wants to help us.